Hello, my name is Steve Webster, and this is my proposed COVID-19 Lakeland, Florida plan. Thank you for considering this. Here's the executive summary. Per worst case statistics from Italy, most deaths are those with pre-existing underlying conditions, which is 99%. We can conclude that a person who has no underlying condition will have a 99% chance of survival. So, who are we protecting? Well, those with underlying health issues. Therefore, Lakeland should encourage self shelter in place for non healthy people and let everyone else resume normal activity and follow the CDC guidelines. In other words, healthy people who catch the COVID 19 will, of course, build antibodies that will help prevent the spread of the virus next season. And optionally, it's possible to give those antibodies through a blood transfusion to the high risk COVID 19 patients for a greater chance of survival for them. So, who am I? I'm an IT problem solver for over 30 years, including solving the Y2K for Marriott Distribution Services. That segment of Marriott is no longer in service, but it was at that time. I'm currently a Google product expert and nominated for Google Developer Expert. And my role is currently president of a small software company called SW Gaps, which is a G Suite automation training and support company here in Lakeland. So, what is the problem? So, again, putting on my problem solving hat, we can say today there's no current problem, but we have a concern of a lack of hospital resources, a concern of too many deaths, and a fear of high risk become infected. So, like Y2K, we had advanced knowledge of a potential problem that could have happened. So, what are these potential problems? Well, overwhelming our hospitals where there is not enough resources for a given day, days, or weeks. In other words, when we look at statistics and read reports, we need to consider stagged. Is it staggered? What is the day or days or weeks? It doesn't matter if we take all the information and divide it, it's really a time-based consideration. These lack of resources may cause greater deaths, of course, and high risk get infected. We don't want that. So those are the problems. However, isolation and closures, well, they'll actually create more problems. So a solution to one problem can actually end up creating more problems, which you also need solutions. So when nearly 100% of the population is sheltered in place or work from home or school at home or become unemployed because of closures of businesses, more problems occur that need solutions. I've actually read some news feeds are now reporting increase in suicides, increase in filed divorces, which means marriages are being strained. Loss of jobs will increase into other industries, like the housing market, for example. And it's like a falling domino effect. One feeds into the other, which can increase the mental health and relationship problems, can create late payments, which concerns cash flows or other businesses, and hurts individuals' credit reports, or they could even be forced into bankruptcy. Focus on hospital resources, not positive cases. To make the point, I would like to share this. 34 million flu cases so far this season, but no one is alarmed with that. It's hospital resources that matter. In 2020, the U.S. flu season so far is about 34 million Americans have been infected with the flu. About 350,000 were hospitalized, but again, they were staggered. They weren't all at once. 20,000 died due to the flu, which is about 6% death rate. And I believe the COVID-19 has doubled that, which is a concern. Media and public are not concerned with the flu statistics at all. It's really about hospital resources, not number of cases. Less resources probably means more deaths. What is not the problem? Well, not test statistics, not number of positive cases, not number of staff at businesses. We should ignore the test stats and positive COVID-19 cases. This data should not dictate or be justification to make public policy. You see, the emotion of fear should be replaced with data and information to make public policy. But the right data and information, like hospital resources. So my point is, ignore the alarmists of, oh, the number of cases are increasing. Who cares? We don't care. We want to focus on the hospital resources. So, what is the solution? Well, we want to protect those with underlying conditions. We've learned that the COVID-19 really attacks the lungs. So, specifically, lung related, and those who have compromised immune systems, regardless of their age. But we also know that as we get older, we have compromised immune systems too. And I did read a stat that a typical flu season, 90% who are 65 or over 65 are affected. So that's an indication that 65 and above have weaker immune systems, generally speaking. So how do we protect the high risk? Well, one, we should self-shelter in place for those high-risk citizens. Shelter in place if you are high risk due to underlying conditions, regardless of your age or you're older. Inform low risk to avoid high risk contact. Ask low risk neighbors to provide or help high risk who are sheltered, like lawn care and groceries. Acquire more resources when needed, and allow businesses to reopen to solve those other problems it can have when they're closed. So current hospital status. Well, as of March 29th, 12:45 p.m., according to the Ledger, there are 6 Lakeland positive cases. Lakeland Regional Health has about 864 beds. It is assumed there are plenty of resources available, so I would say the status is safe or excellent. I would even dare to say the 7-day outlook at this point is going to be excellent or safe as well. Lakeland decision makers need daily metrics from Lakeland Regional Health Hospital. Like number one, how many resources? There's people, there's beds, there's face protection, like masks and shields and ventilators. And then how many are actually available? Establish a threshold of what determines safe and not safe. Do we have multiple levels of statuses? Excellent, good, fair, whatever. That has to be established. And then we want to trend the curve of those resources. Are they trending up? Okay, fine. But are they trending up at an alarming rate? Because if it is, then more drastic measures have to occur. But if they're not, let the data speak to us. We don't need to be alarmists and make policy based on everything looking good at this point. So that goes into the last point. Lakeland positive rate is slow. There's plenty of beds, and I'm suggesting that the next 7 days actually look safe from our hospital status. So Lakeland's fine right now. However, I decided to create 6 points that are somewhat bold, but it's up for discussion. So here goes. So my proposed COVID-19 actions for Lakeland, Florida is the following. Number one, starting April 1st, which is Wednesday, announce a self-shelter in place for those high-risk citizens that we talked about and those 65 and above. No, any low-risk citizen who has high-risk family members, like I have myself, should also be included in that self-shelter in place, or at least minimize exposure and take extra precautions. For example, I have older parents who are considered high risk in this situation, but I can go out and very carefully get groceries and other things and minimize my exposure, come back, disinfect the bags and everything I brought in, and take extra precautions. Number two, at the same time, kick off a Lakeland Help Neighbor campaign, where each neighborhood would provide free services to self-shelter-in-place neighbors, like lawn care, groceries, notes of encouragement, prayers, and things like that, phone conversations. So that also begs the question, well, how do you identify those people? Well, they could fill out a form on the Lakeland website, I suppose. Perhaps a sign could be put on their lawn to let other neighbors know. Number three, allow all businesses like restaurants to operate with CDC guidelines in place. For example, the washing of the hands, disinfect surfaces and doorknobs, social distancing, etc., except for high-risk staff. So if there's someone who is high risk because of underlying condition or age, they should not be participating in that work environment. Now, of course, this needs a governor approval because of the current restraints. Number four, on April 12th, which happens to be Easter, allow church services for low risk only. The governor would need to approve that because of the current restrictions in place for the state. And what number 4 will accomplish, it will help with people who are having mental stress, anxieties, especially, plus celebrating the religious observances of Easter itself, and turn a negative into a positive. So that's my suggestion there. Number 5, whenever Lakeland area hospital resources are satisfactory with a reasonable buffer and the day's temperature is at least 80 degrees, then go ahead and allow indoor and outdoor events to occur. I'm making a note here that as outdoor temperatures rise in the spring and summer months here, the COVID-19 surface life on picnic tables, at water fountains, public water fountains, is assumed to be much less in life. It will die much quicker underneath this heat, based on some of the news feeds I've been reading. So there's less chance of spreading. So that needs to be verified as well. And number 6, once COVID-19 flattened curve has been achieved and dropping, or it's just already low, then go ahead and allow high risk to actually conduct normal activities. In other words, the end of the pandemic. So here are some assumptions and opinions I thought I would like to throw in. One assumption is high-risk Lakelanders will adhere to the self-shelter in place. In other words, some may believe their risk is low and attend restaurants and events. So I'm talking about someone who may be 80, 90 years old to say, I'm a healthy person. Yes, I'm taking blood pressure medicine. Yes, my kidneys may not be operating 100%, but I'm not on dialysis, but I still want to go out. I need to get out of this place. So that's an assumption that will they actually adhere to the self-shelter in place. Assumption number 2, Lakeland hospitals, beds, the masks, the ventilators, and other resources actually have accurate data to determine safe resource status. In other words, I'm suggesting in the next slide that we actually have third-party auditors involved. Assumption, the Italy statistic, and that being so many people have died in Italy, then they peel back the onion per se to say, okay, out of those deaths, how many had underlying diseases? I actually saw a pie chart to say, well, some had one underlying disease, some had 2 underlying diseases, and some had 3 or more. Out of all those who had 1, 2, or more underlying diseases, 99% of those actually died. Less than 1% died going in as a healthy conditioned person. So that Italy statistic is 99% survival rate if you catch it without an underlying disease. So that should be repeated statistically for the entire state of Florida, Polk County, and Lakeland. So that needs to be accumulated. So that's the assumption. An opinion. I've been reading the Ledger to keep up with the news as well as other media, but it sure would be nice if the tone, the alarmists, would change, because they should stop the alarming the public with these positive cases, because it really doesn't matter. We need stats on those who have actually died with underlying conditions. We need number of hospital beds, available hospital beds, and the same with these other resources that matter. There should be a shift, in my opinion. Last opinion is those being COVID-19 tested only have about a 5 to 10% chance of positive result. That is not alarming. So in other words, for example, unfortunately, my mom, I had to call 911 just last Sunday. She had low oxygen content. She caught something 7 weeks ago. Pollen came in. She had underlying conditions of asthma and some other things. And so she went into the hospital, shortness of breath, all these conditions, but they said she was not deemed to be tested. She didn't meet all the criteria like x-ray results and so forth. So she was diagnosed with something else that wasn't COVID-19. So my point is, it's very difficult to be qualified to actually get tested at this point in our time. And when you are tested in that poor health state, there's a 90% chance you don't have the virus at all, 95% chance. And that is certainly not alarming. So in summary, exposing all healthy people to the COVID-19 have a 99% chance of survival. Those healthy who become infected will build antibodies, which could be transferred to hospitalized COVID-19 patients and lessen the chance of a pandemic next season. Now, to make this point in an extreme way, it is actually okay with this line of thinking to have all low-risk Lakelanders actually get infected in the entire Lakeland area, several hundred thousand people, let's say. It's okay if we all get infected if you're low risk. There's a 99% chance you're going to survive. And those antibodies will help us to be healthier for next season as well. Focus on hospital resources and not positive cases. Third-party auditors to verify when a hospital has reached safe resource status is recommended. Just a double check and some accountability there. Allow businesses like restaurants to reopen and to serve the low risk and include dine-in, because again, there's the economic impact which creates other problems. And by allowing them to open for the low risk, then that solves other problems. So as a disclaimer, the data that I gathered was from various media sources, so they should be verified further with experts in data science and the medical field. Thank you for your time.